Living with lupus can feel like fighting an invisible ghost that only you can see. Clinical advice is a start, but how do you actually survive the brain fog, fatigue, and joint stiffness when you are standing in your own kitchen? Today, we are looking at 5 creative, evidence-informed ways to manage invisible flare symptoms so you can protect your energy, communicate your needs, and feel a little more in control. Number 1. Energy conservation and pacing shape the foundation for managing invisible lupus flare symptoms. Fatigue is the most common and disabling challenge for people with lupus. Up to 80% of patients report it, and for many, it is more disruptive than pain. On days when energy feels scarce, it helps to picture your energy as a limited supply of spoons, a metaphor many in the lupus community use. Each task, whether getting dressed, making breakfast, or helping with homework, costs a spoon. When the spoons run out, so does your ability to push through. One practical strategy is to structure your day into 90-minute work blocks, followed by 15-minute rest breaks. This approach matches the body's natural ultradian rhythm, which cycles between periods of focus and the need for recovery. For example, you might set a timer for 90 minutes to tackle chores or caregiving, then use the next 15 minutes to sit, stretch, or simply breathe. Even seated meal prep, using a kitchen stool instead of standing, can save precious energy and help prevent a midday crash. Research from the Lupus Foundation of America and recent fatigue studies support these pacing techniques as a way to avoid the boom and bust cycle that leaves many caregivers wiped out by late afternoon. It is important to remember that pacing strategies may help some people, but not everyone. If you notice that fatigue is severe, persistent, or keeps you from daily activities despite rest, reach out to your healthcare team for a more thorough evaluation. This video is for educational purposes only and does not replace medical advice. Lupus symptoms and flares vary from person to person. Always speak with your healthcare team about changes in symptoms, treatment, or symptom management plans. Mama Health helps patients understand what a diagnosis means in real life, not just what the doctor had time to explain. Through the Mama Health app, people living with lupus can get support that reflects real patient experiences and helps make sense of daily life with the condition. In second place, cognitive aids step in when lupus-related brain fog clouds memory and focus. According to the Mayo Clinic, up to 80% of people with lupus experience periods of slowed thinking, forgetfulness, or trouble concentrating. Those symptoms can make even simple routines feel overwhelming. These cognitive changes are invisible to others, but deeply disruptive in daily life. External memory supports, like setting a 10-minute timer before starting a task, jotting down a one-step checklist, or recording a 2-line voice memo on your phone, offer practical ways to navigate these lapses. For example, if you are helping your child with homework, but find your mind drifting, try setting a timer for 10 minutes and focus on just one question at a time. When the timer goes off, leave yourself a quick voice memo. Math homework done, next, snack and rest. This kind of single tasking reduces distractions and helps break larger chores into manageable pieces. Research from the Lupus Foundation of America and chronic illness studies shows that using external cues, timers, alarms, and written notes can cut error sheets and lower stress during foggy periods. Joint protection and ergonomic adaptations transform daily routines for those living with lupus, offering a way to reduce pain and preserve hand function. Joint stiffness is a reality for about 66% of people with lupus, making tasks like opening jars or lifting mugs feel like obstacles. The Arthritis Foundation points out that even small changes in kitchen organization or tool choice can significantly cut joint load forces, easing the strain on sensitive hands. Stocking the kitchen with assistive devices is a game changer. A lever-style jar opener, for instance, can reduce the grip strength needed by half, letting someone open bottles without triggering pain. Placing mugs and plates on a waist-high shelf means less reaching or bending, which helps avoid unnecessary stress on the wrists and fingers. These strategies follow joint protection principles. Use larger joints when possible, keep wrists straight, and avoid tight grips. The NHS and the Arthritis Foundation both recommend micro breaks every 15 to 20 minutes during repetitive chores to help prevent cumulative stiffness. Picture using a rubber grip jar opener to twist off a stubborn lid, or prepping lunch at a counter set at elbow height. These small tweaks can make a real difference, helping people get through the day with less pain and more confidence. Communication tools and boundary scripts offer a practical way to conserve emotional energy when lupus symptoms are invisible. Fatigue, pain, or brain fog often strike without warning, and explaining these symptoms repeatedly can be draining. Ready-made phrases and visual cues recommended by Lupus UK and the Lupus Foundation of America help reduce the stress of these conversations. For example, a simple script is, "I'm experiencing a lupus flare today and need to reschedule. I'll follow up when I'm able." That lets someone set limits without extra explanation. Color-coded cards provide a quick, non-verbal way to communicate needs. Green signals things are manageable, yellow means a break is needed soon, and red indicates immediate rest is necessary. These tools remove the pressure to justify symptoms every time, especially in work or family settings where understanding may be limited. Studies in caregiver communication show that pre-written scripts can lower anxiety and boost confidence when discussing health needs. Lupus UK's guides encourage preparing respectful, concise explanations in advance, so boundaries are clear even when symptoms shift rapidly. Adding a caveat like, "My symptoms can change quickly, so I may need to adjust plans at short notice," helps manage expectations and avoids misunderstandings. While these strategies can make daily life less stressful, they aren't a universal solution. Some situations still require more conversation or support. Micro rest and sensory reset techniques offer a gentle way to manage sudden waves of fatigue and sensory overload that often come with invisible lupus flares. Even a 2-minute box breathing exercise can help. Inhale for 4 counts, hold for 4, exhale for 4, hold for 4. This can slow your heart rate and signal your body to shift out of stress mode. Studies show that this simple breathing pattern can lower heart rate by about 12 beats per minute and increase heart rate variability within 2 minutes, helping you feel calmer and more grounded. Planned low-stimulation rest breaks, such as sitting quietly in a dim room for 10 to 20 minutes, are another practical tool. Surveys of caregivers and occupational fatigue studies link these short, screen-free pauses to lower afternoon fatigue and better focus later in the day. The NHS recommends building in these micro rests before exhaustion sets in, rather than waiting until you feel overwhelmed. If you are in a busy household, a planned 15-minute sit break, even in a quiet corner with the lights turned low, can act as a reset for both mind and body. Adjusting lighting and reducing background noise during these breaks can make them even more effective. If you are sensitive to strong scents or have asthma, skip fragrance-based resets and focus on breathing or quiet rest instead. These techniques are not a cure for lupus, and they may help some people, but not everyone. This video is for educational purposes only and does not replace medical advice. Lupus symptoms and flares vary from person to person. Always speak with your healthcare team about changes in symptoms, treatment, or symptom management plans. Mama Health helps patients understand what a diagnosis means in real life, not just what the doctor had time to explain. Through the Mama Health app, people living with lupus can get support that reflects real patient experiences and helps make sense of daily life with the condition. Across all 5 strategies, one truth stands out. Small intentional shifts can help reclaim moments of comfort and control, even when symptoms remain invisible. Managing lupus is not about perfection, but about finding what works for you today. You are not alone in this journey.